All right, we're back here in the studio Thursdays always when we talk to folks in the medical community. Dr. Claude Jarrett, kind enough to come in. He's an orthopedic surgeon. New Hanover Regional Medical Center does a lot of his work at the orthopedic hospital there. Today we're going to talk about shoulder surgery, and during that story we were talking about the differences. You know, we hear so much about knee replacements, hip replacements. Shoulder surgery, you're saying roughly, we're talking about a 6-month recovery time. And it was interesting why you said this usually takes a little bit longer than these other other surgeries.
Correct. The shoulder is such an intricate joint. The amount of motion, the muscles around the shoulder are rather unique. So the recovery is a little bit slower. It's intentionally slower because we take that into account. But the exciting part about it for most patients, once they reach that 6-month milestone, they're extremely excited about how much more functional their shoulder can be.
The people that are targets for this, you know, I'm going to assume it's more than just, I went to see my doctor, my shoulder is a little bit sore. What are we talking about when you need to go to the length of having surgery? Exactly.
Although the success rate of a shoulder replacement is so high, we still reserve it for patients that have shoulder arthritis that has progressed to the point where their day-to-day activities are significantly compromised.
When you do a replacement, are we doing ceramic now? Is that what we're doing, or what goes into a replacement in the shoulder?
Yeah, so we really would just replace the ball in the socket. So we don't replace the whole shoulder. What we do is provide a nice, smooth, artificial metal ball and resurface the socket to a nice, sophisticated liner.
And the stages through rehab, take us through that. And again, we're talking 6 months. There's going to be some fluctuations on both ends of that spectrum.
Correct. There are typically 3 phases to the recovery. The first phase is a period of immobilization. Patients were in a sling for about 2 to 6 weeks. After that point, then they start to work on their range of motion with therapy, and that lasts a couple of months as well. That last phase is when they really work on their range of motion, activity, function, those type of activities.
With what you do and what you specialize in, where do you put this as far as people are going to get their normal life back? Is this one of those surgeries where, yeah, you know, when this is all said and done, you will be able to get back to what you were doing before?
Exactly. This is one of the type of surgeries that we intentionally offer for patients to allow them to stay active, to return back to those activities that they enjoy to do.
Yeah, I say it all the time, that we're very fortunate to have what we have here in town. You don't have to go to Duke anymore, you don't have to go to Carolina, nothing against those places. You've got it right here in town.
It's exciting. The shoulder replacement surgery has truly been one of the most exciting technological advances in orthopedics.
And the other thing, you smell fantastic. We're back after this. What are you wearing?